There are hundreds of types of cancer. Other cancers can be treated by drugs, otherwise known as chemotherapy, and especially when it has not reached the critical stage. People are often diagnosed with cancer or report to hospital very late when the situation is worse, yet it is curable. A visit to Queen Elizabeth Central Hospital on 2nd November 2013 reveals that the country's main referral hospital in the south has no special ward for cancer patients. Instead, they are temporarily using this ward where patients sleep on the floor, including in the corridors. During daytime, they are forced to camp outside the wards to create space. A cancer patient of less than 15 years old is not getting enough medication because out of the 8 drug mixture they use, only one type of drug is available. This man from Mwanza district has lived with cancer for 16 years. He is in a hospital where healing is not any close. The case is not different for this woman who has been in the hospital for a month and has been diagnosed with cervical cancer, now at an advanced stage. This albino patient has just come at the hospital, and his case is not different from so many cancer patients who need the advanced radiotherapy treatment whose machine Malawi cannot afford after 50 years of independence. While some pieces of the machine can be valued at a price of a single Toyota VX, most of which we see elsewhere in the country, patients die on the waiting list or keep waiting for their turn when government will send them outside the hospital for further treatment. Well-to-do individuals, or indeed those with special connections, fly direct either to Tanzania or South Africa to seek medical quality care. While one can hardly trace the dream of a cancer center in Malawi, the Cancer Association of Malawi, led by their only oncologist at the hospital, Dr. Leo Masamba, has fundraised 29 million kwacha to rehabilitate the clinic section of the ward that was dilapidated. Over 100 million kwacha is still needed to finish the construction of the ward, which will also have 4 isolated rooms for special care, a case that is not at the moment. Apart from the outside friends, including the Tender family, friends to the current president, the highest individual donation they got is 50,000 kwacha, and government has not spent a single penny on the project other than pledges. However, in a rare turn of events, the less expected group to join the fight against cancer is that of Blantyre Union vendors, who organized a fundraising big walk to organize money for the ward renovations.
Tafuratizi mtundu wa Malawi kuti dziko lino ndi lathu la ifeno lawina aliyese Malawi chonchi chifaizi fumatuona ntwachita business mavenda tetengana kugaule kufuna kuthandiza abale athu amene wanakuvutika ndi matenda amene cancer.
Messages can be told from different perspectives. People can hear about them, but the very few that go to the hospital will not find the needed rescue. The current trend in Malawi is against the wish of the World Health Organization, WHO, which requires nations to develop a robust national cancer control program.
The WHO and all the other major health institutions, they advocate that each and every country should have a national cancer control program and a plan, which as a country we do not have a cancer plan. I think we need to move towards that direction, because there are so many things in the area of cancer prevention, early cancer diagnosis and treatment that we need to do as a country, which will help prevent so many unnecessary deaths that are happening due to cancer.
A nurse and matron at the hospital says it is worrying when she sees people dying because of preventable situations.
We are thinking maybe if they could give us the radiotherapy treatment which Tanzania has, which South Africa has, we don't have in Malawi, and we need that treatment to help with the chemotherapy we are giving this time.
Indeed, such deaths will continue to cause havoc if the best action we do is is to deliver powerful sermons at the funerals or merely cry louder as we escort our brothers, mothers, leaders, and children to airy graves. Former UN Chief Kofi Annan once said, and I quote, "We have the means and ways of dealing with the challenges at hand only if we have political will." Mathews, Malata, NBC News, Blantyre.